Hello, everyone, and welcome back to another Pulse Z event. This evening, we are here with Emma Mikhailov. Emma, it's very good to have you back and to see you once again for another Pulse Z event. And today, we are going to discuss a bit more on the topic of medical entrepreneurship, specifically because you wrote a piece on the matter. So, could you first maybe tell us what made you write that specific piece? What determined you to go into this specific field?
So once again, thank you for having me. It's that I'm glad to be back. What really inspired me to write this piece is that, quite frankly, I'm studying in the field. I'm studying to become a midwife, and in my studying, I see a lot of needs that clients may have while they're at hospital, and then look around and I'm like, there's not really something to address that need. And when these clients ask me for a recommendation, I don't really have something to recommend them to, for example. And the only thing that you can recommend them to is something which is not made by healthcare professionals, but something made by someone else, essentially, or something that's not even made full stop. So they have to kind of DIY it, which is not very fair. But unfortunately, sometimes you have to make do.
So, would you say the medical market right now has some needs that cannot really be fulfilled properly? So, you need entrepreneurship in the field to make sure that it still stays actual and up to date with the patient's needs?
So I think that entrepreneurship is always needed a little bit because sometimes having an entrepreneurship mindset kind of helps you to realize that there is a need for something or that something's not being met, right? And if something's not being met, that we have to kind of make sure that it is met. And people might not realize it because they don't know what they may need. It is something that we as professionals should be able to see and identify, because when people come to hospital, normally they don't come because they want to, right? So that's we're coming to a point where it's not like I want to go to hospital, I want to have this. 99% of the time they don't want that. So they're really under stress, right? And it's already a very high impact situation. So if there is something that we can do, we should be doing it, in my opinion. But that's my humble opinion.
And who do you think should lead this charge for entrepreneurship in the medical field?
So I believe that all healthcare professionals, whether it is nurses, midwives, physiotherapists, nutritionists, doctors, anyone should be able to recognize these needs. And we should all have the mindset to recognize them and take charge of them. It should not just one person, because if it's one person, that's too overwhelming on them. Or if it's just one profession, that's huge. Like our jobs, I like to say we're a bit of everything, right? Like I go to hospital and like you become an architect overnight. You rearrange all the furniture in the room. You like end up as a technician sometimes because you're rearranging the entire system, right? So our job's already very vast and demanding. So I think it's like, from tomorrow onwards, all nurses are going to just start doing this as well. It might be a bit much on one profession, but if we all work together, I think that we can get there eventually.
But would you say there's enough support right now in the field for entrepreneurial initiatives?
I think that if if someone does have an entrepreneurship idea, kind of, they would be supported. The only issue would be then time constraints and insurance. And in the health setting, it's more difficult to actually test something and get it approved because of ethics and like testing and subjects and studies. These things take a very long time, which we see with vaccines, in fact. So vaccines take like 10 years to be actually produced. The COVID one took less time because technically it was already half made and they just engineered it to just kind of fill in the gap for COVID. But that was already half done. When you make a vaccine for something which is completely new, it takes 10 or plus years. So that's saying like basically a decade of someone going to work every day and like putting their heart and soul into doing one thing. So get my point? Like these things take a lot of time, right? And it also is very demanding on us when it takes that much time because it gets mentally very overwhelming. as well. So
So then it's a bit of a balancing act in a way, because on one hand, you have this grassroots knowledge of what's happening in a patient's life and you want to intervene and to provide support and see your idea come to fruition. And on the other hand, you need the technical expertise, the financing in order to conduct research, the approvals and the logistical aspects to be sorted out, which are more easy for the bigger players in a sense to fill out. No?
yes, when you have a bigger company, or I guess a bigger backing because you have some connections, things are always easier in life. That's unfortunately the harsh reality, right? You will get there eventually. Like if there's something you set your mind to, you will get there. I believe in that. But it might take you another year or another 2 years. But doesn't necessarily mean that you should just give up either. Right? I'm always a bit of an optimist. So I always like to push and push for people to always try their hardest and not just try your hardest, so just believe in yourself as well. Because if you don't believe in yourself, really, like you have to be in your own corner sometimes. So if you have an entrepreneurial mindset, you have to push yourself and push for an idea to take place. And know that if you are thinking of it, then there's probably someone out there that needs it. And if they need it, then let's try and help. Maybe not them, but the next person as well.
So then, in this sort of situation, where would you say you see the spot for today's medical entrepreneurs in today's market?
I would say the spot is right up with everyone else. I mean, they are needed, but they are maybe undersupplied, as in they're high in demand, realistically, but it's not something which everyone might think of. Because as I said, we would recognize something which patients don't see when they come to hospital every day, right? Like I might say, I find that there's a lot of mothers coming to hospital that are very overwhelmed when they come to deliver their baby, right? I see that because I work there every day. But you might see, no, that's normal because birth's always stressful and pregnancy is always stressful, right? So having that different mindset helps you to recognize that there is something that you can do, right? So my idea would be, let me suggest like I do antenatal classes, so classes during pregnancy, and that would address the problem, right? That's something that's directly there, right? But then it comes down to the fact that they need to have the time to do it, right? So they can most definitely push themselves to come up with the idea and start it and even go up, right? So I think that eventually these ideas have to not no longer be a DIY situation where we recommend the patient to do this idea, but you have to kind of find this from here, find that from there, and they kind of piece together themselves. It should be something which you can give them a whole product or a whole service.
And do you think right now medical entrepreneurship is a competitive field in Europe? Do you think it has the potential to become one? Are there sufficient financing avenues for medical entrepreneurs across the continent?
So high in demand, I would say yes. As in, you don't really realize you need the help until you actually need the help. Like I could be talking about something which I know, but something I don't know, I you won't know until you actually need it, right? So they're high in demand. When it comes to financing, that's a bigger struggle because you have to actually finance a whole research, right? And you have to finance something which might take years, which you have to get approval for ethics. And these are all very expensive things. And not everything you're allowed to test on like human beings. And you might have to test it on cells or you have to test it on something else. And that is further financing that has to be involved, right? And these things are so expensive, even insurance is expensive. So we say, it's really simple, just go there and do this or that. But till you actually approve something, it takes a long time and with reason to, right? Because we don't want to give something which can harm the client or their families. But you have to kind of strike the balance as well.
So then it's a very big step to make forward if you're a healthcare professional to decide that you want to become a medical entrepreneur, knowing all the risks, knowing all the effort involved. So what do you think should be an incentive for a healthcare professional who works in a traditional job to make this jump forward? How would you convince someone to try and push more towards medical entrepreneurship rather than staying in the hospital?
So I would encourage them to do so simply by reminding them why they had the idea in the first place. Because if you have an idea, it means that you've met someone that you wanted to help and you couldn't. And it will not be the last time you've done that. So sometimes I go home and I think, what could I have done to help this client? And I think of something I said, that's not really possible in Malta, or that's really difficult to get to, you know what I mean? Like it would take a long time to get to that point. So you have to kind of always remember where you start from. Then you have to also encourage them. Maybe if they are lucky, their colleagues at their shift might support them in this endeavor. So they might even start by talking to their colleagues, forming a bit of a group to not just be by yourself, right? I think there's always a bit of strength in numbers, especially when it comes to things like healthcare. The more opinions you have, because you can talk to me and you can talk to my classmates, you can talk to my lecturers, and we will talk about the same thing in different ways, right? For example, I have a different opinion than someone who's been working for 25 years because I'm been at the words for 4 years now, but I still have a very limited knowledge compared to someone who has all these years, right? So I think that when you have multiple mindsets together, then that might also encourage a person to think forward. And then there also comes the incentive. At the end of the day, I believe when you go into a healthcare setting, you're doing it to help people. Like if you don't want to help people, it might not be the right job for you, right? Because it's very socially and emotionally demanding to always listen and think and act actively, not proactively, not responding, right? So we're always on alert. Even when we're having our coffee by the desk, we're not having coffee by the desk, I promise you. Um, so you have to always be on alert. So then you have to always remember, well, there's a reason behind all this. And hopefully, after that, you can go forward. Kind of, you can take the next step into entrepreneurship. You can say, okay, today I talk to my colleagues, tomorrow I'm going to sleep on it. I'm going to think about what I can actually do. So, what is the next step, right? You might even go and say, let me ask maybe the in charge of the ward if I could do a small trial of something. If it's a simple procedure, you can even go to the ethics board and try and approve it that way. But you have to always do a proposal first, right? So the whole proposal and time and paperwork. But I believe that it is worth it, right? Sometimes it can even be a service. So if you want to offer a service, that's also entrepreneurial based, right? Like
Absolutely.
you can just offer a service. There is a need, especially with healthcare, with a social need as well as a physical need. And sometimes I feel like we're so focused on getting people better that we forget that they don't just heal the physical, but heal the mental as well, right? So we can't just focus on getting task A done and forget the other task. So maybe in a fast-paced environment, might also be missed. So I hope that in the future, with entrepreneurial based ideas, we might even tackle both sets, as in both issues that clients may have.
What would be some entrepreneurial initiatives you've seen in your day-to-day life in the medical field that really made you say, wow, that really made you gain a new appreciation for the idea of medical entrepreneurship?
In Malta, I had the opportunity to interview a group of midwives for my article, in fact. And it was lovely to interview them. It was an honor. Genuinely, I'm still amazed that they allowed me to interview them. And I had my internal fangirling moment as well. and, and I had the opportunity to sometimes even see them like as working midwives. And it's amazing to see how they bridge the perspective of both social, emotional, and physical care because we don't just have a one client, we have two, of a family in our case as midwives. So, we can't just tackle the birthing person or the birthing mother and forget the partner because, they're going through it as well. And we have a very big tendency to focus on one person, especially childbirth. So I loved seeing how they interacted with both people in the room, how they interacted with everyone, and then how they also taught others. So, for example, last over this weekend, there was a conference in Malta, which was international, and I had the opportunity to go, and they did a small workshop there as well. And they brought something which we don't normally do in Malta, which is like a holistic technique called rebozo. And they taught it, not they taught it, but they explained how to do it, not for us to do ourselves, but to understand what it is. And it was so honestly therapeutic to just watch, not just to go through, because I wasn't done on me, but it was therapeutic to just watch them do it. It was amazing. And you see how much holistic care there is, right? And it's not just the physical aspect, because it tackles a physical need, right? But it also goes into the mental, emotional, psychological well-being of the person undergoing this technique. And you really understand that it comes from a passion, it comes from a drive, this like need to help people, this urge to say, oh, this may be something difficult, but we're going to help, even if it's a minor way. Because sometimes I think I'm doing something really small in my place of work. I'm like, this is something I do every day, like every 10 minutes I do it, right? But my clients tell me, oh, I'm really thankful for you telling me that. I'm really thankful for your time. I'm thankful for you sitting with me because I felt so alone. And it's so sad that people feel alone. I'm very like emotional in the sense don't like when people are alone or when they feel alone because when someone is scared, it's the worst feeling. And having them then it's like see me in the street and come up to me and talk to me is honestly like both really gratifying. Like I'm really grateful for it, and also like you realize how much of an impact you have every day, right? So when you think about it, these people they go, they offer services, and these clients, even when I see these clients in the wards and hospital, they tend to know more about what's going on in their bodies, and they feel more empowered with their choices. So what started as just a drive to help people led to the client being more in control of the situation, more like knowing of their bodies, which I believe is very important, especially in our community and in our society. You should know about your body. There is no one should be afraid of their body. And unfortunately, sometimes I notice it. So this drive to help people helped so many people, and it's also inspired me in the process. So that's why there's an article in the first place. So I'm very grateful.
And I'm guessing also through medical entrepreneurship, you can address, in a sense, more localized issues to some extent, because obviously you have medics and doctors who are basically pillars of the communities where they operate. They know the community's needs best. They know where and how to intervene. They know what might be some common problems that people are facing. So I'm guessing also through this entrepreneurial mindset, you can adapt the services that you offer as a healthcare professional to the community you're serving and to their needs.
Exactly. So, for example, what this group did, I'm going to take them as an example here. They offer like continuous support during pregnancy. Again, they're of midwives, so this is very on theme for us. But they follow the couple from what we call preconception, so before the pregnancy, which is an aspect which many countries miss, right? And from before pregnancy, they start talking to them about what they might need to do before pregnancy, what exercises they should do, what is maybe some lifestyle adaptations to start from now. Then they might continue to the pregnancy, seeing them intermittently, like they would go to a private doctor. Because the most lot of private practice of doctors going on. So instead of going to a private doctor only, they would also come and see the midwives, for example. And that led to what we call continuity of care. And continuity of care means that the clients get to know this professional and they get to also understand. And when you trust someone more, you're going to listen to them more, want to appreciate their opinion more. And when someone tells you, Isma, I think maybe you should try doing a bit of this, it might help you a bit. If I'm a complete stranger, you might say, she's a bit crazy, this one, I don't know what you're saying. But if it's someone that you want to take that opinion more with importance, I guess, like more personally. You're more like to act on that opinion. So it might be something very small, and sometimes the things we say it might sound a bit like, "I'll go for a walk, go for a walk." As I'm walking every day, I'm tired to walk. And these are things that people actually tell me. Okay, when I tell them go for a walk, they tell me, "It's mata. I'm 9 months pregnant. I don't want to go for a walk." And I'm like, "That's your choice, you know. I'm never going to force anyone to do anything." But when it's someone that you know telling you that, you get to trust them. So you trust them as both an individual. So you trust them as, and then you trust them as the health professional as well. And that together means that you have tailored care. And through tailored care, that means that you are getting the best care that you can ever receive, right? And it's not just a one size fits all box where it's like, because in hospital we do have a checklist. So that we make sure that everyone gets all the information that they may need. But sometimes they don't need information on, for example, I don't know, caring for a cesarean section wound. They don't have a cesarean section, and that's okay. But you can't give them the advice for it, kind of. It's a stupid idea, right? Because it's realistically, you would not give the advice, but sometimes not giving advice just in case. Because then we never see them again. So, because we have a system where it's like you come here, you meet me, you go somewhere to meet someone else. That means you only meet one a pregnant woman at one point in her pregnancy journey, which is and pregnancy and parenthood journey, which is huge. You also have 9 months span of pregnancy and then a year afterwards. So we never really see them again. You meet one person once, and there's a whole reshuffling. And also it comes to a point where it's like every time you see someone new, you have to reopen your case, kind of. So you have to restate what you are, restate your scenario. So if your pregnancy is going straight forward, if it's not, I don't know if this is your fourth MRI and no one's picking up anyway anything. If your last appointment didn't go well, you have to explain that over and over again. Whereas if it's with the same person, then you are being followed the whole time, and they know you, right? So then it can also go faster, the process. Because if you know someone and they know you, that means that you are going to guide them into something which takes less time and less cost as well for the overall system as well. So that's a very good example, I think, of how it can help directly both individuals involved, kind of.
And obviously, since we're seeing such a huge benefit for the community and people who are basically being cared for in a tailored manner, and it produces such a positive impact, then we can slowly get towards the conclusion that medical entrepreneurship can provide better health services in so many cases. But then, how do we cultivate this mindset amongst healthcare professionals?
You don't just have to cultivate the idea, because the idea itself, I think, when we were all young, we want to do it, right? Like, if I talk to all my classmates right now, we all want to do it basically because it's beautiful to be able to see it. Because even for us as professionals, it's like it gives us more satisfaction because I get to know you and build a bond with you, right? So I always know when you come in, who you are, what your case is, and I go home with more satisfaction, right? But then there comes the kind of reality that when you're young, it's more difficult because of the insurance costs, and you have to have a certain amount of years of practice. I think you can't do it in the first 2 years. Um, so we don't have to just cultivate it inside internally, because let's say I wait a couple of years and I apply for the insurance when I financially can, and I can practice outside of hospital. Amazing, right? That's the first step. Like you got into that point. But then you have to convince people to come to you. Why? Because we are realistically always in a system where it's like, whatever happens, go to the doctor first. And I'm not against it. I will always advocate for people to have contact with their doctors regularly, have regular checkups. I love that. Nothing against it. But especially for things like pregnancy, for example, midwives are the experts of normal pregnancy. Doctors are the experts in pregnancies which are more complicated. So, but if it comes down to it, someone's going to tell you, but we always assume the worst kind of on ourselves. We think, it's bad. You know, you want to always tackle the worst situation you can ever tackle. And I can understand because at the end of the day, you're like, it's your life. And it's not just, picking if you're a pink or blue shirt in the morning. It's huge choice. But if you actually think about it, we can actually guide people into saying, oh, let me see how your pregnancy is going. Let me see how you are pre-pregnancy. And I can guide you to if you should be looked after by midwives or doctors. For example, if I'm going to go for an ultrasound, it can be done by a radiographer, not just by a doctor. If you go to doctors, why? Because they have more clinics open. Nothing against doctors. I believe they do an amazing job to help their clients. I don't mean any misunderstandings here. But it's a harsher reality, I guess, that there are other professionals which can offer the similar or same services that we often leave in hospital. Because we leave those in Pesce Malta, those are free services. And since they're in hospital, it's like, those are not as good as the private ones. And it's like, okay, sure. If that's what you want to believe, I will not tell you no. But we are just as strange as everyone else, kind of, right? So that's a bit of a sad perspective. So you have to both tackle the inside hospital people, so the healthcare professionals who have to step out and get this insurance and get a place and even get equipment because equipment is also very expensive and find an office where they can sit and make sure that it's in a good place, blah blah, and ensure confidentiality always, because obviously we have to always make sure the client is always confidential, and a lot of health online systems is well to take care of. And then you have to tell the people to actually come to you in the first place. Because if you do all those steps and no one comes, you're going to stop there. So it also comes the move like educating people and educating society, right? Because we have a tendency to over medicalize things because we are almost scared of getting sick. And it's okay to have a fear of being sick or coming to hospital. I can understand it completely. But there also has to come a bit of a balance. That Motiz was saying, ما تنفشش راسك قبل ما تكسرها. You don't bandage your head before you break it, kind of, right? A very rough translation here, but it's true. Because we tend to overthink and get scared. So, like, I have this glass, I'm gonna wrap it in like bubble wrap and it won't fall. And it's like, okay, but the glass is plastic, you know? So you have to kind of tailor it like to what you need because sometimes having so many tests is not good for you either because you end up with more anxiety. It's not necessarily something which is done badly, but it's not something which might be meant for you. So you have to always kind of try both ways.
Would you say there's more and more openness from the side of the public to go for healthcare solutions provided by medical entrepreneurs rather than traditional healthcare facilities?
I think that there's an I know sort of people are almost scared of hospital. Like, in fact, there's a thing called white coat hypertension. So when these people come to hospital and they see a white coat or a midwife, a doctor, anyone, a nurse, they immediately get so anxious that they get hypertension, they get high blood pressure. And we would say, it's so high. Oh my goodness, we have to like, take action now. Let's go on the vitamin, la vita. And it's like, whoa, how's your blood pressure at home, my dear? And they're, no, it's 100 over something. Like, whoa, that's low. How is it 160s now? So then you have to always like say, let me give this person 15, 20 minutes. I'll talk to them a bit in the meanwhile, and when I check it again, it will be the normal 100 over 60s. And you would think, oh, imagine I gave this person medication. Because if you did, you would have sent this person to pot. So I notice a lot. So if they can avoid hospital, these people will avoid hospital, right? Is it necessarily always a safe choice? Not exactly. I will not lie. Because there are some things which yes, they have to be medicalized. They don't have an operation in a picnic area. I wish, but it's not very safe for you. You get my point. But you can find ways. For example, if it's just an appointment and you want to see, I don't know, a doctor, a midwife, a radiographer, a nurse, an allied professional, you can go at a clinic, which can look like a house, kind of. And these things, they exist. For example, Again, I want to take midwifery as an example because it's the most I know about, right? Abroad, not in Malta at the moment, we have things like birth centers, and these are places where you can go and they look like a house. So, for example, there are some that are attached to the hospital and some which are not attached to the hospital. But yeah, essentially, it would be the same thing, right? Same as the hospital, exact same. The same equipment, the same things that you need, the same facilities. Only difference would be so simple. The rooms would not be all white. They would be colored. The bed would be a double bed half the time. There would be a pool. There would be a proper bathroom. There would be a space which is not sterile, which is not all big and bad. Like I really don't like, for example, the second people enter the hospital, the birth room in our hospital, there is opposite exactly the neonatal resuscitator, we call it. And we use it to heat up the baby's clothes, honestly speaking. Nothing else. Okay, we really use it for anything else. But like we use it to put the baby up, mommy showers and nothing else. So it's not used for emergencies. When you see it, it's huge. It's this big thing in the corner. You think something's going to happen. So automatically you're starting with a negative mindset. Now in the birth center, so would be there, hidden in a closet. Wow. Big cahoot, you know what I mean? Not a big difference, but it's just out of the human eye. And that makes people feel more at ease. And we know that people feel more at ease, they can trust us more as professionals. And they can also trust the system more. And they can also progress better, like especially in labor, there are multiple studies that if your mother or a birthing person is not relaxed or not feeling psychologically well, they feel highly anxious, they will not progress in labor because that's how the body is made. That's how much of a difference psychology makes in our bodies, right? So simply by adapting and giving places outside of hospital as an option that kind of mimic our everyday life, as long as it is not a high stake situation, because then you have to understand that your health takes priority over comfort sometimes, unfortunately, right? Then you can understand this is not, let's meet halfway. And for example, you go to a clinic and the clinic has a normal chair, not one which is broken. What it is that it makes a creaking sound when you sit on it because they're very old, right? It makes you feel more at ease. Even when you go, it's not immediately all this clean area. So I think that's very much needed. But this is my perspective. Someone else might tell you, oh no, I must go to hospital because I feel better there. And you think, okay, so the hospital is still needed. We're not saying it's not needed. So some people will still tell you, no, I will go to hospital above all else. Even if it's just a fever, I will go to hospital. Right. So I have to tackle, first of all, the fear of having a fever in the first place, right? But I have to also make it available for them to go. So give always both options to all the people.
It's about offering alternatives. After all, it's about
Exactly.
offering each person the place and the context where they feel the most comfortable.
And where they can be helped the most. Like I would love to offer always the lowest like setting, like the lowest hospital-based setting, because yes, it does make people feel better. But if I have someone who we consider high risk, I cannot give the same, let's say, not the same opportunity, because you can give the same opportunity, don't get me wrong, but I have to make sure that things are more accessible, not just in a cupboard, right? So the birth centers are more in cupboards because they're not used as often, the things. But if in hospital, there's everything always at your hands. And it's easier because I can work faster for me, not to take things out and maneuver. So you have to always offer and also keep in mind the person and what they need as individuals. So very important things and very big things, and very logistically very huge things to think about.
And as a final question for today, I would like to ask you, what do you think would get more young people into medical entrepreneurship, more young professionals into this field? What would be the push that they would need to follow this idea and to turn it into a reality in their case?
So I think that the biggest fear, like even for me, I think about it, it's the insurance. It's a very big cost. And there's a reason why it's big cost. Because there's a life of a person. It is not just offering you a cup which stays heated all day long. You know, that is something if your coffee goes cold, memx tagħmel, you're not going to die with cold coffee. Let's call the iced coffee then, so it'll be even better. But if I give you something, or if I offer you a med something and it doesn't work for you know what I mean? Like if I tell you, no, no, don't worry about your blood pressure, just stay home and relax, keep zen, it might work if your blood pressure was just by one elevated. But if your blood pressure was sky high, I'm not going to tell you that because it's not going to give you the same results. So we have that responsibility in our hands at all times. And that's why insurance is that high. And not just the insurance, it's also like personally you feel more responsible because you are responsible and that's huge on you. Like mentally, when you make a bad decision, you can mess up, someone's life essentially. There's very rarely cases that happen like that, but you might always think, what if it's me? That one off, what if it's me? Or what if you have everything by guidelines? So you might have all the safety checks once and twice, 3 times. You might have done everything right, and something still goes wrong. And you think, oh, I'm not in hospital to handle this. I don't have someone more senior than me, you know? So these are always things might be at the back of their minds. Maybe if maybe we have more classes, for example, on how to be entrepreneurial mindset even in healthcare. If we can also be guided, right? As in the sense. In our course, we have many, many study units and with many, many very important things to learn. But if we have, for example, not everyone might want to be an entrepreneur, and that's okay. There is always something different for everyone in life. That's very fair, right? But say it's offered. I'm not just entrepreneurial for everyone because it's not the same for me and for you. That's reality, unfortunately. I cannot have the same background in entrepreneurship as someone who's going to be doing like technology and an app because it's completely different. Speaking from experience, because when I was in a company program, we made an app, and it's completely black and white difference. I will not lie to you. Um, so yes, there's still a lot of legal work involved. That's always with entrepreneurial things, always, because you're taking on a responsibility. But I think that we are almost always, as medical professionals, scared of the big bad things happening. And even they have like a 0.0.0.0.1 no 0.0001% chance. We still think of that because we are trained to do it. Right? We are always trained to think of the worst scenario so you can prepare and then it will not happen. But it's good it did not happen because that's great. But we always prepare for the worst thing. So then we have to actually go and think, now you're on your own. You always think of that 0.0% chance that is going to happen. So you won't take the big step. So a bit of confidence in yourself, understanding what is low, what is high risk, right? Because you cannot offer to everyone realistically. Again, with health, it's not a one size fits all situation, right? And a bit of, you know, even guidance with handling the insurance because it's something I hear a lot. This insurance, it's a very big problem in the sense, especially in our case, apparently gynecological sector. It is second after like price after surgery. So we're saying surgery is here, and like gynecology and midwifery is here. And you would tell me why? Because un- unfortunately, let's say it's realistically, like it's a good thing as well because it's part of our job. We have both the life of the birthing person and the pregnant person and the life of the fetus, which is also a responsibility. And it's not just their life, but their future life as well. You have to set them up for the best life that they can possibly have, not for, you know, whatever comes. It's not doesn't work. You have to always set up for the best situation. So there's a bit of that, a bit of mix and match. But I think it's important to understand what you know, understand what the people need, and if you can bridge the gap with what they need and what they can have, even better. It's that might take you a bit of a long time to get there. It might take you less time than what you thought, it might take you more time than what you thought. But as long as you always have it in your mind that, I am going to help by bridging this gap, then you might think it's worth it at the end of the day. I believe it's worth it at the end of the day, right? Because I am a very kind of like optimist kind of person. But you will not understand how much someone actually needs until you go through it yourself. Or someone that you love goes through it themselves and you think, that is something which they should need. But if they're in that moment, you can't give them something like this the next day. So it takes time, it takes efforts and hard work. But eventually, when you have it, you will be thanked tenfold for the effort that you put in. So that's what I think would help.
Emma, thank you so much for this very insightful discussion and for this quick excursion into the world of medical entrepreneurship. I think it was very interesting, and I think a lot of young people who are thinking of a healthcare career, who might be watching, might take a second look at their options and also maybe try and explore something new. So thank you so much for everything, and thank you for this very nice discussion. And to everyone who is watching our online events, thank you so much for being with us, and we wish you a wonderful evening.
Good night.